Hello, everybody. My name is Al Pernia. I want to welcome you to the Change Life Destiny show. I'm here with Eric Marlin from Medeia,
It's a pleasure.
and I want to welcome you, Eric, to our Change Life Destiny show. Tell us first a little bit about yourself.
Thank you, Al. So I work for a company called Medeia. We're a manufacturer of neurology equipment. And we have a new device that I'm going to be talking about today called BrainView.
Fantastic. So, what is this technology? What's so special about this technology that we're so excited about?
So this technology has AI in it, and the technology itself is really nothing new. EEGs have been around for decades, since the 60s. And all that we've done is inserted an AI in the device, so you no longer need a neurologist or a college-trained EEG technician to parse the data. And it's been revolutionary because it's one, streamlined workflow for a lot of neurology clinics, but then two, it's given access to a diagnostic tool normally required. Let me start over with that. So basically, if a primary care doctor had a patient come in and they see signs of dementia or something like that, they'd probably want to refer out to a specialist. Now they don't have to do that anymore. The doctors using our device tell me, previously I had to refer this patient out to a neurologist, and they would do 3 or 4 visits there, and then the neurologist would say, aha, you need a pain clinic, or we need to start doing sleep studies. Here's a sleep lab. They say, Eric, with this device, I don't have to refer out as much anymore, and I can save this patient thousands of dollars and time. They're not getting kicked between all these clinics. I can just scan them in shop and treat them here, and if I can't, I know exactly where they need to go.
That's amazing. That's
Yeah.
incredibly effective and fast. So that in one visit and in one location, people could get that kind of benefits. What are some of the conditions that you can address with this technology?
Oh man, EEGs have been used for a lot of conditions. It's actually amazing that they've been around since the 60s because they have been able to characterize a lot of different biomarkers associated with ADHD, ADD, OCD, anxiety. It's standard care to use an EEG for things like TBI or dementia, Alzheimer's. You have imaging techniques like MRIs and CT scans. Those are great for looking at bone. MRIs are great for looking at soft tissue. But if you do an MRI on an individual with ADHD and an individual who's perfectly healthy, the brain's going to look the same anatomically. That's where an EEG comes in. It's looking at the electrochemical activity of these brain cells talking to one another. From those patterns, our device is able to deduce certain conditions. A Nature paper just published a couple of months ago showing that there are marked characterizations within asymmetries of the frontal lobe with individuals that have, different kinds of schizophrenias.
It's important for both practitioners and patients to understand this is non-invasive.
Absolutely non-invasive. There is nothing going into your skin or your brain. This is like a silent observer. It's just watching the brain cells talk to each other.
And what kind of practitioners can use this in their practice?
Oh, well, the neurologists were the first one to really pick up our device, and that was kind of by our design. We wanted to benchmark it against existing tools by other major manufacturers. And man, they ran it side by side. And those other tools, which require a neurologist to read the data, these neurologists were saying, man, this thing is 10 for 10. It cleans up the signal a lot better, and it makes it easier for me to read, and I don't even have to read it. So after the neurologists started using it, well, of course, the family doctors referring out to them started hearing about it, and they started picking it up, and then the pain clinics started picking it up. We actually even have lawyers using it now for personal injury cases, because before they had to convince the judge, my client has TBI because this defendant over here ran into him with his car. Now they can just pop him on a brain scanner and show him the math. This is the electrochemical activity in their brain. And thousands of research studies have shown that this kind of activity is indicative of a TBI.
So that means if the lawyers are using it, it's actually the chiropractors that are implementing it. Is that correct?
Well, there are chiropractors using it. I have seen them referring to a lot of neurologists for that kind of stuff, and the neurologists are then coming in and reading the report and saying, yeah, this is pretty standard. I use a device just like this in my clinic. And it's really the judges just wanting to make sure that it's real.
And is this staff administered, or does the practitioner have to do it?
It is staff administered. And when I say automated, you're not even supposed to be in the room while this is running, because you don't want to have the patient focusing on you or getting distracted. So it requires minimal staffing.
And once you get the report, what's the protocol?
Well, you'd want to create a plan of care for the patient, but it will tell you down there, I'm seeing, 4 out of 5 biomarkers associated with dementia, or I'm seeing brainwave patterns associated with OCD. It'll even lay out a plan of intervention. It'll kind of walk you through the plan of care. It'll recommend everything from, dietary restrictions to different kinds of physical therapies, or even medications like, hey, this patient has dementia, here's Aricept, or, there's stimulant medications you can pursue. It does that because it knows that every practice likes to wield itself differently. Some doctors like to take a more delicate approach. Others like to just hit it with a sledgehammer. This is something we absolutely need to take care of now.
So it's really phenomenal. Then what you're saying is that you have this technology that a clinician in a non-invasive manner can implement in their practice, where it's almost automated, the process of evaluation, and the reports that come back gives them pretty much the plan of action on what they should do.
Exactly. We're opening up an entire new diagnostic tool that these physicians would typically have to refer out for. And this alleviates worries of patients being retained by specialists. It alleviates worries of, well, is he going to get it done? I mean, how many patients do doctors have come in and they want them to go to this other clinic to get this thing taken care of? It's hard to even get them in the clinic, They're already here. Let's take care of it now.
I mean, there's such a huge population that could use this kind of service.
Yep.
And these clinics can expand their offerings much beyond what they are doing right now. So I want to encourage you to come to the Change Life Destiny conferences and expos that we put on across the country. You can learn about them by going to changelifedestiny.com and find out more about the technologies that Eric's talking about and others who are going to be at this conference. I want to thank you again for being here.
Thank you for having me.
Appreciate what you do, all this technology that you're bringing to society. And I want to thank you for your time. Thank you and goodbye.